The shocking pathway now that I was really surprised when I saw the data and the studies is that bacteria also travel through the nerves. The research has shown that 90% of disease starts in the gut. But here is the crucial connection that often gets missed. The gut starts in the mouth. Bacterial infection is real. But because the teeth are inside the mouth, and sometimes you don't even have any pain related to that, you put it off. To illustrate the scale of this problem, tooth decay is the most common disease globally. I'm Dr. Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. Hello and welcome to Mind Your Mouth. I'm Dr. Maria Florou, and I'm so glad you tuned in today. We are going to be diving deep, sharing with you the truth about health that most people completely overlook. You might think you know the basics, brush twice a day, floss occasionally, but we are going to go far beyond that. If you are ready to challenge the myths and truly transform your well-being, not just your smile, but your entire well-being, then let's get started. On this episode, we are going to talk about how the mouth plays a very important and essential role when it comes to your overall health, and what's happening to the rest of your body. Our core thesis today is powerful and based on modern research. The research has shown that 90% of disease starts in the gut. That's a huge movement towards understanding gut health. We see patients taking probiotics, doing special diets, and testing their gut health. But here is the crucial connection that often gets missed. The gut starts in the mouth. Imagine that the mouth is the gateway. We're not just talking about teeth and gums today. We're going to discuss habits and things to do and things not to do in order to keep your teeth in good check. But more importantly, we're going to discuss how this seamlessly simple topic impacts your brain, your heart, and even your sexual performance. Yes, your sexual performance. So please stick to this episode, watch to the end, and take notes. There will be a lot of information here that can help you, help your friends, and even your family live a better life. Share this episode, change small habits, and you are going to see big impact in your life. First, I want you to think and answer to yourself honestly, and put it on the comments if you want to share it. Which category are you in when it comes to oral health? Category 1, are you the person who flosses at least twice a day and brushes twice a day? And on top of that, you go to the dentist at least twice a year, or in the way that your dentist specifically recommends to you. This is diligent category. Category 2, this is the person who flosses just when it's possible. Maybe you floss if you feel that something stuck on your teeth, or you sometimes try to be good and floss once a day or once every 2 days, and you still brush twice a day. When it comes to the dentist, you go either once or twice a year, depending on how you feel about it. Now, category 3 is the person that brushes once a day, who doesn't floss, or who either goes or doesn't go to the dentist. It really depends on how the schedule is, and maybe they just keep putting it off. So who are you in this scenario? Which category are you? 1, 2, or 3? This is very important to understand. Why? Because this is not just how you feel. It's how the actual mouth influences your body. We need to understand why we might recommend 2 visits a year, why sometimes once a year is enough. But critically, we also need to understand why some people need to see us 3 or 4 times a year. We will explain the reason why throughout this talk. Now, let's address the fundamental truth that most people don't realize. Cavities are bacterial infections. When we talk about oral health and what happens beyond the mouth, it's really important to listen to that phrase. Bacterial infection is real. You can imagine yourself with an infection on your lungs that you don't treat, or an infection on your toes that you don't care about, or even an infection on your nose that you are just not going to treat. That simply doesn't happen. But because the teeth are inside the mouth, and sometimes you don't even have any pain related to that, you put it off. we must see the importance and how that infection is really silently affecting your health. To illustrate the scale of this problem, tooth decay is the most common disease globally. Let's dive into this topic and understand the mechanisms better. The mouth is a very dynamic environment. We eat, we drink, we kiss, we talk, and sometimes we even breathe through the mouth. And all those factors play a big role in how our body is healing. Specifically, our teeth go through a constant cycle of demineralization and remineralization. I know that it sounds like a complicated word, but if we break it down, it means the structure either breaks down minerals, which we call demineralization, or it builds up minerals, which we call remineralization. Let's look at the anatomy for a little bit. Imagine that your teeth are like eggs. The outer layer is the enamel. The enamel is like an eggshell. It is the hardest structure in our body. Yes, enamel is the most mineralized structure in the body, even more mineralized than our bones. The second layer is dentine. Dentine, on the other hand, is a little bit more porous and a little bit softer than enamel. And the third layer inside is what we call the pulp, which is where the nerve and the blood vessels are located, right at the core of the tooth. What is important about the mineralization process then? It happens because we have some bacteria present, but most importantly because we have the pH of our mouth dropping to an acidic state. The ideal pH that we want to see is the neutral pH, which means a pH of 7. We can even check this at home with simple pH strips from a pharmacy. When we drop the pH, the enamel, being really strong, withstands nicely without any damage. The pH of 6. But watch out, if the pH drops to 5.5 or lower, enamel starts breaking. Once we get to the softer part of the tooth, the dentine, the bacteria really go crazy. They grow really fast there because it's a more porous part. Now, people often ask me, is there a way of reversing cavities? Yes, the body is amazing and it can actually heal and reverse the cavity. However, it's going to depend on how deep the cavity is and how much of the tooth has already been affected. So just recap just a little. The outer layer, the enamel, is really hard. Imagine that that's breaking down and then the dentine starts getting affected and that's softer. So bacteria start spreading from there. Let's go back to the concept of healing now. Obviously, it depends on how far the cavity grows. We can either reverse it or not. And sometimes the pulp gets affected and we end up having the need of a root canal treatment or even the tooth being extracted. But here is the critical distinction that is often missed. The tooth will heal provided that the cavity is only on the enamel or just starting to break into dentine. That's a very important thing to listen to. When the cavity has gone to the softer part, the dentine can't withstand a pH lower than 5.5, and anything that drops from that, it's really going to deteriorate things very fast, which is not a hard environment to have in the mouth. If you have a cup of coffee or an orange juice, your pH is already lower than 5.5. And being a dynamic process that never stops, we're always eating and feeding our bodies, so the pH is always dropping and going back up to an alkaline environment where we have remineralization happening. Another thing that really influences the whole process here is what you eat, but also how often do you eat. We hear a lot about fasting nowadays. I'm not going to talk about 18 hours fasting or 2 days fasting and autophagy here, but I am going to talk to you about how fasting influences the remineralization process and how that influences the healing of your teeth. The body is very wise in its systems, in the way that it regulates itself. When we eat, we tend to have a more acidic saliva. This is partly because the foods that we eat and the need to break down those foods to facilitate digestion. We want an acidic environment in the stomach to actually contribute to digestion and to stop a lot of the bacteria that we are swallowing from propagating to the gut. But when we stop eating, the mouth actually flushes new saliva and the pH goes up. This is when we start having healing. Now, imagine a person who eats constantly, someone who is constantly snacking on food, what happens then is that the pH cannot regulate itself. We're constantly in a low pH in environments where we're constantly feeding our body. On top of that, if we don't have proper oral care, the plaque is sitting there. What is plaque? Plaque are colonies of bacteria. They become more and more acidic the longer they stay in the mouth because they gain strength by just sitting there. The new bacteria attach and stick onto the surface of the teeth. When you have constant food feeding the bacteria and you don't have enough time for healing, with the saliva being more alkaline, what happens? The bacteria start penetrating the teeth by breaking down the structure of the enamel. We have an acidic environment that is actually etching that enamel and opening the pores for the bacteria to go in. I think this answers the common thought that sugar is the main villain of oral care. In fact, sugar is not the only problem. Obviously, it contributes to the problem with oral health and overall health, but the core issue is the constant eating, the quality of what we eat, and the pH of our mouth. So, what is ideal? Allow your time to heal through a period of fasting. Fast for at least 4 to 5 hours between meals. If you decide to have something sweet or an orange, for example, try to have it close to a meal time and not later down in the afternoon. So that will give you the chance for the saliva to flush with more alkaline saliva and for healing to happen. Obviously, for the saliva to reach the tooth structure, plaque shouldn't be sitting there. So good flossing habits and good brushing habits have to be present as well. Other factor that really plays a big role in the process is the salivary flow. Our body is wise and every organ has a cycle. We have more saliva production happening during the day, especially the morning. And as the hours of the day go by, we have less and less saliva forming. Some medications can contribute to a lower salivary flow. We also have syndromes and other conditions that contribute to low salivary flow. And that's when we see more and more problems happening, not just with teeth, but with the gums as well. If you were drinking a lot of caffeine, for example, that's also going to drop the amount of saliva that your body can produce. With a drop in salivary flow, we have less water and less saliva flushing out the bacteria. Critically, we also don't have that natural alkaline pH in our body. We know that on average, an adult should be drinking 250 milliliters of water per waking hour. In the case of people who take medication that causes dry mouth, such as antidepressants and stimulants, or if you are a big fan of coffee, drinks, and caffeine along the day, that number should increase. You should drink more than 250 milliliters of water per waking hour under these conditions. The other option is discuss with your doctor if you can change the medication or what else can you do to help with salivary flow. Another critical factor is mouth breathing. When it comes to oral health, apart from the detrimental effects that mouth breathing has on general health, we know that it causes dehydration of the teeth and gums. Again, the dehydration alters the number of good bacteria versus the number of bad bacteria that we have in the mouth. When we breathe through the mouth, we are causing dehydration. The air is not being filtered through the nose, and we end up breathing more bacteria, more viruses, and more fungus in the air. And that can really affect our health. If, apart from when you're talking and laughing or exercising, you still need to breathe through your mouth, my recommendation is look for some help. Look for a myofunctional dentist or someone who can help you to retrain yourself. Breathing through the nose should be our natural state. Another thing to avoid is alcohol. Recent studies show the increase of the incidence of oral cancers depending on how much alcohol consumption is there. Alcohol causes some dehydration as well. It also changes how the good bacteria and the bad bacteria interact, and that increases the risk of problems in the mouth. Not just oral cancers, but decays and gum disease as well. Make sure your dentist is checking your cheek, lips, tongue, and the roof and floor of your mouth during visits, just to make sure that there's nothing changing there. Now, let's look at the alarming reality of bacterial infections. Remember, we established that cavities are bacterial infections, but these infections don't stay localized. First, simple but crucial, bacteria are contagious. We are spreading that bacteria to the people we love, to our children, to our partners, and to the people close to us. Do this for yourself and for the people that you care about. Take better care of your oral health. So how does bacteria exactly travel from the mouth to the rest of the body? I have to tell you, I was researching the most updated information for this episode, and I was genuinely blown away by what the data shows nowadays. Bacteria spreads in 4 major ways. One, through chewing and swallowing. We chew bacteria and we swallow them. They go to our stomach and then to the rest of our body from there, depending especially on the acidity of your stomach. Remember that the gut starts in the mouth. The second pathway, it's through the bloodstream. Bacteria go inside the gums, between the teeth and the gums, and from there, they simply travel to other parts of the body. Your bloodstream travels everywhere, thankfully, and the bacteria travel along with that. Breathing is the third way. We inhale bacteria, and as we have discussed, if you breathe through your mouth, we're going to see more bacteria, more virus, more allergies happening there. The shocking pathway now that I was really surprised when I saw the data and the studies is that bacteria also travel through the nerves. So it attaches to the nerves and it travels to the teeth and to the other parts of the body through our nervous system. And that includes our brain. So what happens with the brain? It's what I mentioned on previous episodes. Alzheimer's is affected by the bacteria that we have in our mouth. When I heard that it affects the nerve, I was really, really shocked. I have to share that with you because I don't know how you feel about this information. Put on the comments here. Let me know how that makes you feel and if that makes you want to take better care of yourself. We know that these are very interconnected systems and we need to protect ourselves the best way possible. We need to look at how the immune system is responding because when the body is chronically inflamed, the whole system suffers. So if this information is valuable to you, if you feel more motivated to take care of your health, put on the comments down below, share with the people that you love and share with the people that maybe are sharing bacteria with you, and you can take combined action to improve your health and the health of your family. Thank you for tuning in. Hit the like button, share this video, and let me know your thoughts. I've noticed that most of you like the video, you watched till the end, but you still haven't subscribed to our channel. So if you haven't done that, subscribe now, and I'll see you in the next episode. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.